Hi, everyone. So, can everyone hear me?
Yep.
So we're all here, ready to go?
Yeah.
So let's begin the meeting. It's 6:32. Let's do a roll call. I'm Kay Peterson, Chair, present.
Steve Krescal, member.
John, you're muted. Still muted. Let's see.
John Quackenbush, member, also present.
There you go. We got it. So we have some, yes, maybe it would be good to find out what you're here for so that we can be sure to take care of that business as early as possible in the meeting so we don't keep you waiting.
Sure. Hi, I'm Al Sapir, and my wife Goldie Sapir is here. We are residents at 35 Brookfield Road. Actually been in contact with Jason, and thank you, Jason, for making this happen, letting us know about this meeting. So we're actually both physicians, and I also practice in Dover, so we are kind of familiar with healthcare is our field. So so basically, we're trying to put a pool in our yard. We have two kids, 11 and 8. So we started the permit process as everyone else should, and because we were again being a little too cautious in safety aspects of anything, we went for the most advanced technology. We asked for a contractor to envision an automatic pool cover, and once we filled out the paperwork, we realized that actually that is not recognized by Town of Dover as an advanced safety measure, despite the fact that 2015 ICC, International Swimming Pool and Spa Code, is adopted by the Commonwealth. So I think the point being is for us who take safety to another level, and we would like to do that, and willing to spend more time and even resources to satisfy that. I think there should be some encouragement to have that as a safety measure rather than just an old technique of fences. So I would like to either ask or comment about and also I did a little bit of research, not too much, not too exhaustive, but neighboring towns like Sherborne, like Needham, like Natick, and Carlisle, and Sudbury, and other towns that I'm not aware of, they have adopted this as well as Commonwealth. So I would like to hear your point of views, and I don't know if this is an appropriate venue to discuss that. Just basically, I would like to bring that up. Thank you.
We'd certainly be happy to talk about it. Hey, John, do you know you're sideways? I don't know if you want to turn your, there you go. That's better. It's a little disorienting to look at you that way. So I'm glad you brought this issue up. Jason and I have done some looking into this issue. Dover requires compliance with the state building code, and but the Board of Health also requires that there be a barrier around a pool, even if a pool is in compliance with the state code. About 4 years ago, or before 4 years ago, the state building code required a barrier around a swimming pool in all circumstances. And then around 4 years ago, there was a push by the pool industry to change that to exempt pools from a requirement of a barrier if they had an automatic pool cover. This was despite pushback from the building inspectors organization, which felt that there was no evidence that having an automatic pool cover without a barrier around the pool was a safe strategy. Nonetheless, it was pushed through, as best I can tell from talking to building inspectors and having done some reading online, through the it was pushed through by industry, by the pool industry. So the building department is not allowed to exceed the state building code, but the Board of Health does have that authority to do that. Ours is not a building code, it's a safety code. It's our own, it's a Board of Health regulation. My feeling is that until there's a clear evidence with public health agencies that this is a safe strategy, that we are not, I'm personally am not interested in seeing us move in the direction of eliminating barriers around swimming pools. Anyone else on the board or Jason want to comment?
So, Terry, you know, I appreciate, I'm sorry, I missed the gentleman, but I appreciate his point. We moved into our house in 2000.
Hey, John, it's really
Yeah.
hard to understand what you're saying.
We moved into our house in 2019, and we have a swimming pool. And I appreciate gentleman's point about the cover, but you know, I would bet that most of the time that pool is uncovered. And I think part of the problem and part of the concern is that if it's open at night, and you know, I hated the idea of having to have a fence too, because we had to go through lots of hoops to get a compliant fence. But I do appreciate the fact that it does prevent someone from climbing the fence, you know, late at night, jumping into the pool, however unlikely that is. And so, you know, I would also be hesitant to remove the requirement to have a better barrier, even with the automatic cover. So I agree with you, Kay. Was that more understandable?
No, barely. I got half of it, unfortunately, but yeah.
I think that if I could sum up what I think you said, John, it's basically that having an automatic pool cover does give you some added safety beyond the fence, but that the fence is important, and that you support continuing to require fencing around a pool.
Yes, much more concise than me.
Well, that's because I only heard about 10% of your words. Steve, do you have any comments?
Without additional personal research, I certainly at this point support your position. I'd have to be convinced that with really good data that that's a way that is safe as current requirements.
You know, there was something published by the CDC within the past couple of weeks about pool safety. It had much more, the focus was really on teaching people to swim and the importance of that. But I thought I might email the person who was the lead author on that paper and ask if there is somebody at the CDC who's interested in this particular issue, and see if they are collecting data about the impact of barriers and automatic pool covers. No one at the Department of Public Health is knowledgeable about this. I asked a couple of people and didn't really get us any answer that addressed my question. One other issue that in doing some research I learned about, and that is that Walter, our building inspector, suggested that we might consider modifying our regulation to be more explicit than we are about the requirements that we'd like to see for fencing the perimeter of a pool. For instance, ours really are very general, and they presume that they work in concert with the building department code. But since the building code now allows an exemption, Walter thinks it would be better if we are very explicit about requirements, and we could refer to the ICC, which is the International Code Council, detailed guidance about pool barriers, which includes things like not having horizontal bars on the barrier that could be used as steps by a child or an adult. So I think I like that advice, and I would like to propose that we begin to work on revising our regulation to make it a little more explicit.
I'm sorry if I may ask a follow-up. So the last part I didn't fully understand. You're saying the building department is asking you to do more on this in terms of making it more prohibitive or making it more explicit, or what is exactly happening with that? Because from my understanding, again, I'm not well versed in this topic, which I will be hopefully soon, and I will do my study, and happy to work with you together on the studies on the safety. But from what I'm understanding, the Commonwealth has already adopted this exempted pools with auto cover. So what is the building department asking exactly?
They're not asking, they're just suggesting that we consider making our regulations very explicit now. They would not be any different than they've been in the past, but making them more explicit about the ICC regulations about fences themselves.
So one other issue I have is we would like to put a fence around our property for various reasons. But because this is kind of very gray zone, I really don't know what the exact requirement. We would like to have a fence. We would like to have auto cover both. But again, we're confused here, and I don't want to spend time and effort to because basically we are neighboring Powasset Farm and also reservation. So our backyard is a playground for deers. So I would like to protect that with actually higher fences, but I would like to go a little bit further in the woods rather than being just around the pool. And I don't understand what the regulation basically limits us or provides us here.
Well, I would refer you to the ICC code for the details about fencing. It's very detailed, and I can help you get that if you don't have it.
Yeah, and just if I may jump in, Al, to answer your question, as long as the pool is completely surrounded, it really doesn't matter how you do it. So if you want to just do your entire perimeter, you certainly can, as long as it's, as long as the fence is at least 4 feet, any gates are self-closing. You could just fence in the whole property if that's what you guys want to do, as long as the pool is enclosed as part of it. It really doesn't matter.
Well, but as long as it meets the ICC code, right?
So thank you, Jason. So what I'm understanding, we accepting some of the ICC codes, but then we imposing a little bit more on it. Is that the fair assumption?
Yeah, I would say that we're the ICC code is what we've been using up to now and will continue to use. The part of the ICC code that exempts a property that has an automatic pool cover, we will not abide by, and we have the authority to do that as a Board of Health. So the ICC code, the portion of the ICC code that addresses the characteristics of a barrier fence have not changed. The only thing that's changed is the exemption. So those the criteria for the construction of the fence are out there and easy to find, and we can help you do that.
Okay, one last question, if I may. I don't want to take the whole time of your meeting, and I promise you this will last, but have you looked at what other towns have done in this regard? I'm pretty sure they have concerned citizen and they studied this to full detail as well.
I have not done any research about that, but it wouldn't change my mind because I don't think that there are any data about the safety of this strategy of exempting pools that have automatic pool covers. I haven't seen any, and I have not heard anybody say that there is some out there that I haven't found yet. Steve, you had your hand up earlier, I think. Did you or not?
You've already said what I was
Okay.
to say.
Okay.
I just wanted to mention quick too, just as a last thing, so we can wrap up on this here. Our pool code, our Board of Health pool regulation is 30 years old. It hasn't been revised or anything since 1995. So you know this whole thing with the fence, it wasn't like it was done to complement this whole automatic pool cover thing. Our regulation was written before automatic pool covers were even a thing. It just kind of, you know, worked out the way it did. So I mean, our regulation could certainly use revisions and updating, which I think was kind of what Kay's point was, just making it more in line with what 2024 requirements are, and just kind of updating some of the language and terminology. And another thing too, I've worked in 3 health departments, and I've never really known of one that has its own pool regulation. So the way we could do it in Dover is kind of a very Dover specific type thing. If it wasn't for our pool regulation, any residential swimming pool requirements would just defer to the state building code, meaning an automatic pool cover would meet the requirements. But you know, in our case, you have to meet the state building code, and you also have to meet our Dover health regulations. So that's kind of what we're looking at here with all this.
Okay, thank you. Thank you for everyone's input. But I would like to follow up on this. I would like to look at the data myself, talk to other towns, because I'm pretty sure a law that is regulation has been 30 years old, needs a bit of refreshing, and then looking at least from a citizen standpoint, I would urge the team to have a second look at it. Thank you very much for your time. Again, sorry it took more than 20 minutes of the meeting time.
No, we're happy to have you, and it's a good question you raised, and we're interested in the issue. So thanks for bringing it up, and thanks for coming to the meeting.
And Al, I'm happy to stay in touch offline. I know you and I have exchanged emails, so don't be a stranger. Feel free to reach out, give me a call, whatever's easiest.
Sure. At some point, you will see me probably at the Board of Health when my kids are a little older. So
Absolutely. Welcome anytime.
Okay,
I also
thank you.
wanted to say thank you. Thank you all.
Have a good night.
Thank you
Okay.
both for joining us and sharing your concerns, because the way we sort of figure out where we need to think about our current regulations is when citizens raise concerns. So it wasn't a problem. It wasn't a bother. We really do appreciate you joining us.
No, thank you for all you do for our town. Fantastic. We're very happy through COVID. You did a fantastic job, so we're fully supportive of Board of Health. So thanks to you all again.
Thank
a
you.
good-
You guys, thanks.
Bye.
Bye-bye. So shall we carry on with the agenda?
Please.
Our next meeting is scheduled for September 9th. Jason is proposing that we not have a meeting in August, given it's the middle of June now. We have July and August and probably not much activity. So I'd like to ask what you all think about that.
No, we reserve the right to always hold a emergency meeting with adequate public notice.
Yeah,
Yeah, we can always
That's-
put something together if needed. That's not a problem to put together.
but we would default to meeting September 9th unless something comes up.
Yeah, so that's the Monday following Labor Day, just so everyone is aware. I figured we'll plan to reconvene on that date, and if anything changes, there's plenty of time to change it or put something else together.
Is that good for everyone's calendar? Steve, John?
Sounds good to me.
So far, got a little event upcoming that may change that.
All right, so, but let us know quickly if you discover something that comes up, so we don't have to change at the last minute. All right, so we move on to minutes from March 4th. What do you all think of displaying the minutes and going through them that way?
I just wanted to ask quick, since we have Priscilla here. Priscilla, do you remember where we left off with these March minutes? It's been so long, I really don't know what the status is. I assume you haven't received any edits or anything.
Nope. In fact, if I remember correctly, I had given Steve a copy, a hand copy, and he said he loved what I had written about it. And Kay had no comments, and I didn't hear anything from John. So I think we're good.
I have no comments. They were great.
Well, I also think they were great, and I've read them, and we could pass them if everyone's in agreement.
I like the
So
sound of
moved.
that.
Someone just made a motion and I missed it.
Yeah, Steve,
I'll
you-
second Steve's motion. Which I think was to adopt them as written.
that's what you move, Steve?
Yes.
Okay,
And I will second it.
okay, all in favor? Aye. Kay Peterson.
Steve Crusco.
I, John Quackenbush.
Okay, done. All right, 22 Edgewater Drive. Jason, do you want to show these? Do we all want Jason to show them, or are we okay having him approve them, given that they're not controversial?
The latter.
The latter, okay,
I
So-
agree.
all right. So we'll skip on to number 7, the health director update.
Do we want to formally vote to approve those?
Oh,
Just so
yes,
can
we do.
have it
Yes,
for the
we do.
record?
Yes, all right. A motion?
So I
So-
move we approve the plans for the septic system on 22 Edgewater Drive.
And I move we approve the septic system for 24 Powasset Street septic.
Oh, I'm sorry.
No, that's okay. So
24.
somebody second them.
Second the first one and motion the second one. We can vote on them together.
And I second the second.
All in favor? Aye, Kay Peterson.
I, Stephen Crusco.
And I, John Quackenbush.
Okay.
This is the most jovial meeting we've ever had.
Priscilla, tell us what's on your mind, something clearly.
Okay, so John made a motion on the first one, Steve seconded it, and then it switched for the Powasset, correct?
Sure.
Yes.
Okay, good, thank you.
Um. So do we have to vote on every septic proposal? Is that, I'm not questioning whether to do it or not, except that it just suddenly occurred to me that if Jason has the authority to approve them, and if that's fine with us, if
I-
they're not controversial, do we then need to vote on them also?
I wouldn't change the modus operandi regarding that, just in case for some remote reason it comes back and bites, as
Yeah.
it has once.
Uh-huh.
Yeah, I mean,
Yeah, I think it also protects Jason too, that somebody else is looking at them.
I think the only time the board absolutely has to give some sort of approval is if there's variances involved.
But,
Um, One of these does have local upgrade approvals as part of it. That's 22 Edgewater, but that's really not a variance. That kind of falls into a different category. That's more of an in-house type approval.
This is not an onerous task. I wouldn't change our modus operandi regarding this.
Agreed.
I think that makes sense.
Yeah, and if anything comes up, between now and when we meet again, I'll just, handle it how I've been handling it as I see fit.
Okay. Now are we ready to go on?
Yes.
Want to do your update, Jason?
Sure, yeah. It's been a few months since we've met, so I figured I'd kind of give a little bit of an update, just to kind of let you guys all know some of the happenings. Big thing right now is summer camps. That's consuming a lot of my time. I've been out to do 2 inspections so far. And I have 4 or 5 other ones coming up in the next week or two. You had a question, Steve?
Yeah, as you drive into Dover from Needham on the right, the second or third dwelling has a sign in front of it regarding a summer camp. Are we on that one? I hadn't noticed a sign previous to last week.
I don't know any idea what's on the sign?
It advertises a summer camp
Steve, is that as you drive into Dover on Center Street?
on Center Street,
On the right?
on the right.
So
It's
is
about
that,
the second or third dwelling
about where,
before the Grace Church.
before the Grace Church?
Yeah,
But definitely not the Grace Church.
seemingly not.
And is that where
All
Precious?
precious.
Beginnings-
It's all precious. It might be All Precious Camp or something like that.
So maybe it's Precious Beginnings.
Precious.
that-
Or
that's a
Precious.
pre-
Oh,
that's a
is that on our list?
No, I've never heard of it. But I'm happy to check into it.
So if a preschool, first of all, I don't know that let me back up. So Precious Beginnings has a preschool. They also are trying to do an after-school program during the school year. That's what the movement to put in the sidewalk along Cross Street was all about. It's possible that they're trying to do a camp for their preschool this summer and call it a camp.
I think
But
camp is on the sign.
Yeah, but it's also possible that it's for older kids too, since they're trying to get into working with older kids during the school year. In which case, that's clearly the kind of camp that Jason reviews. But what if it's a preschool quote camp, Jason? Preschools often call themselves camp in the summer when it's really just preschool. And we don't. Do you know anything about that?
Yeah, I'd have to double check. Camps have to meet specific criteria. And you're right, in a lot of cases, they may call themselves a camp, but it might actually be something else. But the problem is if you're advertising as a camp, which it sounds like they are in this case, then you're automatically held to the same camp standards as everyone else.
Yeah.
So like a lot of times, like the easiest example is like, one of my towns, there was a baseball camp that wasn't actually a camp. It was, 3 days a week for 2 hours in the morning. So they ended up just changing it to a baseball clinic and they advertised that way. So either way, I mean, they're advertising as a camp, so I'm happy to look into it. So it's down by the Grace Church. Is that what you said? Or
If you go down towards Needham, it'll be on the left after Grace Church.
okay.
And the sign definitely says something about Precious Beginnings.
I believe so.
That would make sense. And Jason, can a camp have preschoolers in it? Do you know?
Yeah, I don't see why they couldn't. There's no there's just you need to have a higher counselor to camper ratio. think if it's for kids under 7, it needs to be 1 to 5. So you can, it's just the requirements differ slightly. But no, that's good sleuth work, Steve. I'm happy to check in on that. But yeah, anyway, I'm fully in summer camp mode right now. So that's been very busy. We've had a few interviews for our admin position. So working on that. I think we've kind of narrowed it down and hopefully be able to figure something out in the next couple of days. HR was out for a few days. She was sick, so was able to catch up with her today. Kay and I today were on personnel board meeting for an update on our nursing position. Not much to say on that other than I guess we'll see what happens at their July meeting.
Well, I think we made a little bit of progress today, which is that they seem to tacitly agree that the public health nurse and Jason could have the same grade. That was the question at the last meeting. They were saying that because Jason's a grade 4, the nurse would have to be a grade 3, but that would mean that she would have a salary that would never allow us to hire anybody. And now they're saying she can, I shouldn't say she or he could be a grade 4. But they didn't talk about salary, and they didn't, what's the term they use for leveling? It's not leveling, but determining exactly where somebody goes. They have a special verb that
Step?
What?
Step?
Well, they determine the step and they call that process something. Doesn't matter. So that's what they'll do at the next meeting.
Oh,
So
are you talking about the scoring?
the scoring, thank you.
Yeah.
That's the term, scoring the position. And then they should be able to give us a salary range.
Yeah, so basically I just had to provide data showing nurses' salaries in our area and how they compare to the health director's salary. So I found some good data on that really supported our case. So yeah, just working its way through the process and see what happens at that next meeting. Other than that, we've had a couple of complaints recently, all of which you guys are aware of. Not much to give in terms of updates. They've all been dealt with accordingly. Not to go into tremendous detail on that camp one that I shared with you guys, but I am going there on Thursday just to do their full camp inspection and just also do a little bit of follow-up on that complaint just to make sure they're doing what they're supposed to be doing. Other than that, reaching the end of the fiscal year here in a couple of weeks, so I've kind of been doing a couple housekeeping type things too. Food permit renewals are coming up here. Current food permits expire when the fiscal year does. PAFs for Linda, myself, any board members that receive stipend, Linda's review, just things of that nature. Other than that, not much else to report. Just plugging away as always. Office is in good shape for the most part, so working on those couple hires and yeah, see what the summer brings. Any questions on anything I mentioned or anything I may have missed?
Just wondering if you have any concerns or anything that we could help you with.
Good question. Not really. I mean, Linda and I are holding down the fort for now. Office closes early some days just because we have no other option. But yeah, is what it is. No, we're making it work. It's not like things are going unhandled or anything's being left undone. Job's still getting done. So no, we're making it work. Kind of lean on each other in there. So
And it does help to have Priscilla doing
yes,
it.
yes, that too.
Thank you so much for doing this.
Happy to. I know poor Linda was like, oh no, not the minutes. I'm like, oh, I can still do the minutes.
We're
No,
very happy. that you
we
can.
appreciate it. Just make sure to let me know any hours that you're devoting to any of this so we can make sure you get taken care of accordingly.
Sure. So far, they're pretty simple. I'll just have to tidy them up. So far.
Can I add one topic?
Sure.
So I'm going to be doing Jason's review. And I would like to ask if Steve and John could send me some comments about Jason's performance so that I could either amalgamate them. I have the feeling we're probably all thinking the same thoughts about him, but I could amalgamate them, or I could into one document, or I could submit them all three, but I don't think technically I would be allowed to write a new paragraph that summarizes. I think it's, somebody once told me that would be a violation of the open meeting law to write a summary that includes everybody's comments as one document. But if I were to say comments from one, comments from another, comments from the third, that would be acceptable. Priscilla, I'm interested in whether you've ever heard anything like that, given.
I was just thinking about that. I was like,
I could tell you were thinking about it. That's why.
I know. I was like, I'm like, wow, would that be about? Well, because you couldn't do that with, like, we couldn't do that with the meeting minutes. You couldn't.
Right.
Well, wait a minute. Let's think about this. So if they send you
Me.
individually,
So if you do a draft of meeting minutes and one member of the board volunteers to correct them and accept edits from other members of the board, that I think would be a violation of
that's
the
a
open.
violation. Yeah, that's clearly a violation.
That would be an element. And so I don't think I could do something like that with comments about Jason. So if I think I would
Could
just,
you have them submit them to Robin?
yeah,
Well, that would be, would that be any different than Kay just putting them together and, basically stapling them and saying, here are the
Here-
reviews?
yeah, I think that would be better to do that. Steve,
It might not hurt if Robin received 3 evaluations.
what I was thinking is that I would submit one form to her, but have board member 1, board number 2, number 3, and their answers to, or their responses to the question, just to make it all one document. But
For what it's worth, since we are an independent board, there's really no specific criteria or anything that we need to meet. It's kind of just up to you guys how you want to do it. If anything, you don't even have to do one, but
Well, Kay has concerns about potential violation of the open meeting law, and we certainly should respect that. But beyond that, we are an independent board, and we can do what we want. We're also independently elected, so
Right.
individually we can do what we wish in terms of submitting our thoughts to HR.
What if the three members sent their individual comments to Linda and just had her compile it and put it all together? And then
Oh.
give it to HR or whatever you guys want to do with it.
I think it would be good for the board members to see the document so that we know what each other has thought without deliberating about it. So I don't see any problem with, and if you all agree with that with having me get the comments from the two of you and then putting them into one document and sending it to Robin, but also sharing it with all of you, because I feel, I mean,
I
to
think
be straightforward about this, I feel as if Jason is really doing a fantastic job, and assuming we all agree about that, I think that we want to know that we all agree about that, if that's the case. I don't mean to put pressure on you if you don't like his aftershave or something like that, but I think it would be good if we are all aware of our various opinions, and that might
But,
help. But
I think Jason's doing a phenomenal job. I think he's really transformed the way the Board of Health operates and continues to propel it forward. And so, I have no concerns at all with providing you with a written summary and then having you, take mine, take Steve's, and write, and you can write your own and then include a short brief summary on the form and just attach all the documents. That doesn't seem like it's violating the open meeting law in any way, taking 3 documents and summarizing them, right? And you'll have the supporting documents there.
Well, let me just weigh in, please.
Sure, Steve.
I am incredibly satisfied with the job Jason has done. I am also concerned with any perceived violation of the open meeting law regarding that. I am also concerned that the wheels of this town grind exceedingly slow. That said, I, without discussion with either John or Kay, have approached HR to make sure that it's attractive enough that Jason stays within our confines. And I expect that what they have thus far promised me, they will adhere to, and we can go from there to keep Jason.
great.
Thank you for doing that, Steve.
All right, so why don't you each send me some comments?
We kind of just did the review, didn't we?
Oh, we did.
Would you settle for a God among men?
I'll write a little letter and I'll send it to you, Kay.
Yeah.
And then, at that point you can just submit it as is. And, I guess we can use the summary from our discussion here.
Yeah, Priscilla can write it.
Either way, thank you guys for the kind words. And thank you for your efforts, Steve. It means a lot to me. I appreciate it.
Great.
I could go back word for word and write this out. I'll send it.
Well, it's very helpful. Thank you, everyone. So shall we move on?
Please.
Okay. So, the next item is the topic of reorganization of the board, which is, I think it's my opinion that we should make a formal decision every year about what we want to do about the board and who is the chair. A year ago, somehow we just ignored it and we moved on without formally, deciding that I would continue as the chair. So I thought we should discuss that again this year or discuss it this year and vote on it. I am willing to be the chair again. I'm also willing to allow somebody else to have a turn. I'm happy to have somebody else have a turn if you want. So,
I move that Kay be the chair for the next year.
I would second that. Thank you for being willing to
Thank
do
you.
it, Kay.
Yeah.
all right, well, thank you for being a loyal, functioning board. I feel like we're doing really well. And
Right. Since this is the thankless job, those are the last things she'll get. So
all right, so we have a motion and a second. Is that correct?
yes.
So, all in favor?
Hi,
I,
Steve.
John Quackenbush.
Hi, Kay Peterson. All right, next item. Old business. Do we have old business? Silence. Okay, so that's it, right? Jason, we got everything you wanted to talk about?
That's all she wrote.
So everyone have a great summer. And hopefully we won't have to meet until September, but if we do, we will.
Well, I mean, we've obviously jinxed it now, and 3 horrible things are going to be presented tomorrow that we're going to have to get together and discuss. So
That's right. We may find ourselves discussing pool barriers between now and September. I'm going to work on drafting a revision of our regulation.
You know, from having dealt with a new home with a pool, I agree. There are places where there could be some additional clarity, but I also agree. I think it's too early to waive the requirement for a fence. So
Yeah.
thanks for doing the work on that, Kay.
I just want to say that it was impressive to hear Walter talking about the role of the pool industry in pushing this forward, despite the protestations of the building inspectors in the state and their organization and the leader of their organization. It really kind of a sad situation, I think.
Yeah. Walter will surprise you every once in a while.
Yeah. He knew all about this and he had very strong opinions. I found something online written by someone who was the head of a Massachusetts building inspectors organization at the time this went through, and in this document he said it was meeting minutes, and he came out strongly opposed to the exemption for automatic pool covers, and he outlined why he was opposed to it, and then I couldn't find anything after that. I actually left him a message because he still works in Central Mass. I haven't heard back from him, but I'd be very interested in hearing the story of what came next. But I'm sure it's not good. Anyway, so we'll probably be talking more about this. All right. So good night, everyone, and thank you.
Good night.
All right.
Right.
Thanks, everyone.
night, everyone. Thank you.
Bye.
Good night. It's
Happy
good to
summer.
see you all. Have a good summer.
Great to
You
see you,
too.
Priscilla. Thank you again.
Take care. You're welcome. Bye.